My name is Amanda Lundgren, and I'm the diabetes educator and clinical dietitian here at Island Health. Without this program, our patients may have to travel up to 90 minutes away in order to get diabetes care. This program is so important. We know that people with diabetes spend up to 3 times more on health costs than people that don't have diabetes. So with this program, we can help reduce complications, which we know is a big part of the cost of diabetes. So we can help reduce heart disease risk, and that includes reducing risk of heart attack and stroke. We can reduce the risk of vision loss, amputations, hospitalizations, kidney disease, and diabetes fatigue, right? Helping people really feel empowered to be able to take care of their diabetes and not feel exhausted by it. A lot of times when somebody's newly diagnosed with diabetes, they're scared. So there's a lot of fear and a lot of stigma around getting diagnosed with diabetes. They suddenly feel like maybe they're very unhealthy, or they're going to lose a limb, or how will they manage this if on top of all the other health complications, or maybe even just on top of other things in life. How are they going to manage this on top of that? We individualize our care in this program, so meeting the person exactly where they are, addressing any kind of fears, letting them know that diabetes is really manageable. So yes, you have diabetes, but there are things you can do to improve your life and still live a very long and good quality life. So the diabetes education program here at Island Health, we cover both one-on-one visits and classes. In the one-on-one visits, we talk about what is diabetes, we talk about lab work and how we can improve that lab work. We review blood sugar monitoring, and also blood sugar monitoring goals from the American Diabetes Association. We can demonstrate how to use the glucose meter so that the patient feels empowered and able to do this on their own at home. We also talk about safety in terms of safe disposal of needles if they are using needles or poking their finger. We talk about high blood sugar and low blood sugar and symptoms and how to treat those things and when is it an emergency. We also talk about nutrition basics. So we talk a lot about pairing carbs and protein and getting enough fiber, getting enough vegetables so that they can really make some good nutrition choices when they leave here on their own. Also label reading as well, which is really helpful when they're going grocery shopping. In terms of the classes, we have 3 classes. So the first class is Nutrition and Diabetes, which we really just go into depth on that nutrition topic, really talking about carb counting and also how they can incorporate more nutrition into their meals, whether they're cooking for one or cooking for a family. In the second class, we talk about diabetes physiology, medications, and complications. So in some ways, this class is one of the most important ones because we teach people how to really take care of their eyes, their feet, making sure that they're staying up to date on their appointments with their doctors and their dentists. We talk about what diabetes is in depth in terms of what are the different organs doing in your body when you have diabetes, and also the different kinds of medication, because a lot of times patients might be prescribed medication that they either don't know how to take or they don't know what it does. So I help them kind of clear up the clouds around medication so they can understand why they're taking it. The third class, we talk about lifestyle change and ongoing support. This class has a lot to do with behavior change and goal setting. We talk about local resources and online resources. So how can they feel supported and what can their family and friends do to help create that network of support? We also talk about exercise here. We talk about the different types of exercise, whether that's resistance training or cardiovascular health and exercise, and how they can increase their physical activity at whatever level that they're at in a safe way. And then of course we review emergency preparedness. You know, if there is a national emergency, do they have enough medication or supplies to be able to take care of themselves during that time? I I am so thankful to be able to do what I'm doing here at Island Health. It means so much to me, and it's so very rewarding to see patients become empowered and become confident in being able to manage their own diabetes and their own health for both them and for their families.